The moment anesthesia begins, your brain doesn't fall asleep, it is actively disconnected. Pain, memory, and awareness are shut down one system at a time, while your body stays alive, breathing, and monitored every second. Anesthesia is a controlled, fully reversible medical state. It is designed to temporarily eliminate pain, awareness, memory, and movement, allowing surgery to occur without trauma to the body or brain. Natural sleep is an active brain state. Even while sleeping, your brain processes sounds, pain, and danger. Under general anesthesia, this responsiveness disappears. Key communication pathways in the brain are intentionally suppressed, preventing external information from reaching conscious awareness. One of the first targets of anesthesia is the connection between the thalamus and the cerebral cortex. The thalamus normally relays sensory information to the cortex, where awareness is formed. Anesthetic drugs reduce this communication, effectively isolating the cortex from incoming signals. At the same time, large scale brain networks responsible for consciousness, including the default mode network, become fragmented. Neurons remain alive and functional, but they stop working together. Without coordination, consciousness cannot exist. Most general anesthetic drugs increase the effect of gamma aminobutyric acid or GABA. GABA is the main inhibitory neurotransmitter in the brain. As GABA actively rises, neurons fire less frequently and less synchronously. Brain actively slows in a controlled, stepwise manner rather than stopping abruptly. As anesthesia deepens, pain transmission from the body to the brain is blocked. Signals from injured or stimulated tissues never reach conscious perception. Memory formation is also suppressed. The hippocampus becomes functionally inactive, preventing the formation of new memories. Motor commands from the brain to skeletal muscles are interrupted, voluntary movement is prevented, and additional muscle relaxing medications may be used when needed. These effects represent the four fundamental components of general anesthesia: unconsciousness, amnesia, analgesia, and immobility. Breathing is normally controlled automatically by centers in the brain stem. General anesthetics reduce the sensitivity of these centers to carbon dioxide levels. As a result, spontaneous breathing becomes weak or absent. This is expected physiology under deep anesthesia. An airway device or breathing tube is placed, and the ventilator takes control of breathing. Oxygen delivery and carbon dioxide removal are maintained with precise accuracy. Anesthetic drugs reduce sympathetic nervous system actively. Heart rate and blood pressure often decrease, and blood vessels may widen. Every heartbeat is monitored continuously. Electrocardiography, blood pressure monitoring, and oxygen saturation tracking allow immediate correction of any changes. During surgery, the anesthesiologist's sole responsibility is physiological stability. They continuously manage oxygen, ventilation, circulation, and depth of anesthesia. Modern anesthesia is one of the safest practices in medicine. Serious complications are rare, especially in healthy patients, due to advanced monitoring and strict safety standards. At the end of surgery, anesthetic drugs are reduced or stopped. As drug concentrations fall, brain networks gradually reconnect. Brainstem reflexes return first, followed by awareness. Memory formation returns last, which explains postoperative confusion. All effects of anesthesia are fully reversible. No brain structures are permanently damaged. General anesthesia is not unconsciousness by accident. It is a precise, temporary shutdown of awareness designed to protect the human body during surgery.